Thanks, CAMOC board for inviting me, for letting me be part in this webinar, and thanks all of you who are joining the web. I have been working as director on Algera Archaeological and Open Air Museum 10 years, and since the last March I'm working at a School of Heritage Foundation, and we had a research and about this research I would like to speak with you. As you know, the May 2020 UNESCO report indicates that more than 90,000 museums around the world have been particularly affected by the pandemic. During the crisis, 90% of them closed their doors, and according to the International Council of Museums, more than 10% will never open again. When the health emergency led to the closure of cultural institutes, the Ministry of Heritage invited the foundation to organize online training events for cultural professionals, ministerial employees, officials of public and private institutions, freelancers. On April 8th, we activated the e-learning platform, and in 3 months registered more than 9,000 users. From April to June, we offer 5 courses, more or less 30 lessons, 14 webinars and 2 conferences involving more than 35 teachers, university professors, officials and directors of superintendencies and museum center professionals sector. The foundation provides higher education and lifelong learning for cultural professionals, and it is also a research institute for cultural policy. We therefore started a research devised by Marcello Minuti, General Manager, coordinated by myself with a collaboration of the foundation experts, and thanks to the guidance of Annalisa Cicerchia, Professor of Statistical Analysis and Cultural Economics. We reviewed and analyzed a collection of 196 articles, essays, studies, webinars, guidelines, and reports that the scientific community, institution, and cultural organization produced regarding possible future impacts for museums. The analysis provided the means to identify 353 impacts that could generate medium and long-term changes in the management and attendance of museums in cultural, economical, social, and logistical area. We combine the 353 impact in 8 main impact sectors, inspired by the area that needed intervention required by the minimum quality levels to join the national museum systems: communication, digital and social media, managing and finances, enhancement, engagement, education, local community, usability, human resources, collection management, and last, safety and security. From the literature and web reviews, and after clustering the collected effects, we selected 32 impacts which we used to conduct an online survey. In July, we asked our user to take a survey and rate which of the 32 emergency impacts would most affect the museum's life, which impact they thought was most likely, which one they believed was most relevant. We got 663 responses. 92% interviewees work in the cultural sector, 56% in the public area, and 44% private or as self-employed. Are 20 years old, and 75% are women. The 5 most likely impacts are: the need for public funds will increase for the museum sector, public, private, and for self-employed. In the long term, the distancing measure will favor the use the less crowding in museums will allow us to experiment with the new forms to enjoy cultural events. Museums will experiment new strategies for engaging the public in order to stimulate sharing cultural content. The most relevant impacts are a little bit different. First, to have qualified staff for web and social media management. To be and guarantee and hire new staff to cope with the transformations taking place in the sector. As you see, likely and relevant are a little bit different, but the for future actions. The first priority is initially promoting the visit to peripheral museums and heritage. And you know how important the widespread heritage in Italy is. The related priority is encouraging networks and hubs for the management of shared services. Priority 2, reskilling the museums of cultural heritage images and being equipped to reduce the risk of digital divide, was also a problem. Priority 3, encouraging a visitor emotive engagement. Priority 7, designing new form of fruition for less crowding. And related priority, listening the community needs, who has to be the first, but is not feel such important. Promote culture as a cure for social well-being, to profile visitor through digital bookings. Priority 4, drawing up sustainable strategic plans. And 6, reorganizing human resources for new needs. Related priority, evaluating the risk of museums' permanent closure and promoting private-public partnership. 8, developing proximity heritage research for cultural tourism. And 9, promoting quality exhibition on local collection and proximity heritage. Related priority is involving artists from theater and musical contexts. Priority 14 and 17 are in the middle ranking, but has to be the first, second priority, in my opinion, are incentivizing collaboration between Ministry of Culture, Heritage and Ministry of Education and Research, and strengthening forms of collaboration with proximity institutions. Related priority is developing coordination by the National Museum System. The last priorities in Italy, promoting direct management by public administration, and second last, museum life experience. In Italy, we heard about so common to speak or to remember the program of CAMOC. Some pain reworking and memory. They were really interesting. And then the last is the digital services. A separate discussion deserves the need to pay attention to special needs. In a year, 2020, in which and inclusion. An interesting article by Andrew Plumley, Director of Inclusion at American Alliance of Museums, titled Museum and Equity in Times of Crisis, and dated April 2nd, expresses the prediction that the crisis will bring issue of equity and inclusion at our interviewers how likely they thought the museum will pay less attention to people with fragility and special needs due to the crisis. The answer revealed that Italians who work in museums consider this effect the least probable among all those proposed. Low probability effects such as a reduction in attention to special needs relegate the priority paying attention to special needs to only 23rd place. In the ranking. Among the interviewees, young people, more than others, attach importance to the priority of offering adequate services to people with special needs. And this data bodes well for the future. Thanks you all.